can you talk about the study that you are presenting this weekend at ESC?
Yes, we are presenting this week at ESC a late-breaking trial with a drug called APOCIII-Lrx, which is an antisense oligonucleotide that specifically targets hepatic APOCIII mRNA. So the drug APOCIII-Lrx is a second-generation antisense oligonucleotide, which is conjugated with GalNAc that basically binds to the liver cell, and therefore that leads to enhanced uptake of this drug. And so it allows for lower dosing of the drug to achieve similar therapeutic efficacy. So before our study, there was a prior phase 1 study in healthy volunteers with elevated triglycerides that had shown dose-dependent reductions in APOCIII and triglycerides. And so the study we have conducted is a multi-center, double-blind, placebo-controlled, dose-ranging study of patients that have fasting plasma triglyceride levels between 200 and 500 milligrams per deciliter, or 2.3 and 5.7 millimoles per liter. So patients not only to enter the study had triglyceride levels between 200 and 500 milligrams per deciliter, or 2.3 and 5.7 millimoles per liter, but also needed to have established cardiovascular disease or be at a higher risk for cardiovascular disease to a number of risk factors, including, for example, diabetes or hypertension. If the patients met these inclusion criteria, they were then randomized to 4 parallel cohorts, and within each cohort, the patients were randomized to either active therapy, APOCIII-Lrx, or placebo. Patients were treated for a minimum of 6 months with active therapy or placebo, and a maximum of 12 months. The primary endpoint of the study was the mean percentage change in fasting triglyceride from baseline at 6 months in each of the APOCIII group versus the pooled placebo groups. We also evaluated a number of secondary endpoints, including the change from baseline in APOCIII, VLDL cholesterol, non-HDL cholesterol, and we also evaluated the proportion of patients who achieved a serum triglyceride level less than 150 milligrams per deciliter, or less than 1.7 millimoles per liter. To make a long story short, we recruited 114 patients in the study. We did meet clearly our pre-specified primary endpoint, which was the percentage change in triglycerides from baseline to 6 months. In the placebo group, there was a small increase of 6% in triglycerides, whereas in patients who received the highest dose of APOCIII-Lrx, there was a 60% reduction in triglyceride levels, and the difference versus placebo reached a p-value less than 0.0001. Interestingly, as a secondary endpoint, we also evaluated the proportion of patients who reached a triglyceride level less than 150 milligrams per deciliter at 6 months. And interestingly, that proportion was 4% in the placebo group, and that increased to 91% of patients who reached a triglyceride level less than 150 milligrams per deciliter in patients who received the maximum dosage of APOCIII-Lrx, which was 50 milligrams every 4 weeks. There were improvement of a number of other lipid and protein subfractions, including APOCIII, VLDL cholesterol, and non-HDL cholesterol. In terms of tolerability and safety, the drug was well tolerated in this study. there was no significant difference in the number of patients who reached a platelet count less than 100,000, which is very reassuring. And similarly, no significant difference in the incidence of renal dysfunction with a greater than 25% decrease in glomerular filtration rate, which is really reassuring. And just in closing, we concluded our presentation at ESC by saying that treatment with this drug being evaluated, APOCIII-Lrx, resulted in dose-dependent reductions in both APOCIII and triglyceride levels up to 74% and 62% respectively compared to placebo. And as I said earlier, 91% of patients achieved triglyceride levels less than 150 milligrams per deciliter or less than 1.7 millimoles per liter at the highest dose of APOCIII-Lrx. Finally, APOCIII-Lrx showed a favorable safety and tolerability profile, with adverse events at the injection site being the most common and without clinically significant effect on platelet count. So all in all, a very exciting result that indicates that targeting APOCIII mRNA may ultimately reduce the residual cardiovascular risk in patients with hypertriglyceridemia. So the take-home message is really that targeting APOCIII mRNA with this new drug clearly reduces triglycerides and ultimately may reduce the residual cardiovascular risk in patients with hypertriglyceridemia.